Recording, and we'll start now, David, yeah?
Yeah, if you press start broadcast
Yeah.
and intro, yeah, cool.
The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone, and welcome to the Introduction to Logic Models for CBA with question and answers. Thanks for registering, and hopefully you'll find the next 80 minutes or so informative and supportive to the development and submission of your operational plan. I'm Jim Asprey, and I've had the pleasure of meeting with most of you. I know there were 40 of you registered to listen in today, and I think we have 29 online at the moment, which isn't bad for a Friday afternoon, so thank you. Yeah, I'm the program manager for our place, and I'm just going to close my doors because it's thunder and lightning. Okay, apologies for that. Okay, and I'm just going to introduce you to the session and manage the question and answer sessions, of which we've got 3 throughout the next hour. The main presenter today is David Morris from New Economy Manchester, who are one of our delivery associates supporting the Our Place programme. David is our expert on all things CBA and logic models, and many of you have probably met with David in one of the earlier CBA sessions in York, Bristol or Birmingham, and I'll shortly be handing over to David to start the session. Firstly, I thought I'd spend a couple of minutes putting this session into context and highlighting why completion of the Our Place logic model has been identified as a key requirement for all areas. And I'll get it out there early by saying that this is a mandatory requirement, and there is a deadline of the 1st of September for all areas to complete this task. And I'll talk more about that later. As you know, we're at a transitional phase of the Our Place programme as we progress from getting ready to getting going. Some of you will already know the outcome of your Year 2 application, whilst others will be waiting to hear and have final confirmation. To date, we have assessed over 120 of the 141. We're just literally getting down to the last dozen or so at the moment. Having sat through 18 grant panels to date, it's obvious from that CBA has been identified by nearly all areas as a key element of the operational plan and your proposals for service co-design and reprovision. Many of you have costed CBA into your 10,000 budget for getting going, in addition to highlighting CBA as the main focus of your 5 days consultancy support. All of this is fantastic. However, is it necessary? As program manager, you know, I want all operational plans to be robust and fit for purpose, and that means having CBA that is appropriate and proportional. It may be that what you're proposing is particularly complex and may warrant detailed CBA. However, your proposal may be more straightforward than you think, and may actually have no real cost efficiencies, and in that respect it may be more simplified CBA. So appropriate and proportional are the key words, and today's session is the start of supporting you to identify what CBA for you is appropriate and proportional to be included in your business case and operational plan. Completion of the logic model is the next step, and I'll talk through the timeline and the ongoing support towards the end of David's presentation. Throughout, at regular intervals, there will be question and answer sessions, and indeed we'll initiate a couple of polls, which is an opportunity for us to ask you questions and get a feel out there for how you're progressing with CBA, etc. To ask any questions, there is a section on the right-hand side of the control panel where you can type your question. I should add, if there are any questions we can't answer at this session, we will address outside of the webinar and get back to you. To support this session, there's also the production of guidance material, which is now available on the rPlace pages of the My Community Rights website, and the slides are also available for this session. In addition to that, for those who haven't attended the 2 sessions we've had, there'll also be a recorded broadcast of today that will be available from Monday. Okay, I think that's everything in relation to an introduction, so hopefully you've got a feel for what the session will involve and why we've actually put this session together, and your requirements going forward, or at least if you don't have that feel now, you will have when the session ends. So without further introduction, I'll hand you over to David. Thank you, David.
Thank you, Jim, and good afternoon, everybody. I hope you can all hear me. I'm on hands-free. If I do fade out or start going quiet, please flag that in the question or the chat box, and Jim can flag it to me, and I can speak up, move close to the mic, and everything. Some of you I will have met either at the rPlace launch event in March in London, or more recently at the sessions we've been running on cost-benefit analysis. We ran a session in Bristol, one in York, and one recently in Birmingham. So if you're at one of those events, hello again. If I haven't met you, hello, and thank you very much for logging in to today's webinar. In terms of the structure of what I'm going to talk you through and show you on the slides, firstly, I'll just spend a bit of time explaining to you what a logic model is and walking you through the stages of the diagram by which the rPlace team want each area to set out their logic model. So that session should bring everybody up to speed. So don't worry if you've never come across the idea of a logic model before. I'll walk you through the steps. After that, we're going to spend some time completing a logic model, and we're going to do that with reference to the Poplar Neighbourhood Community Budget. The Poplar team, some of you may have met Sarah Castro and her colleagues. They've been working for about 18 months now as one of the 12 trailblazers, if you like, for rPlace. And we turned their experiences and their proposal into a logic model that I will walk you through today. Hopefully that should give you hints and ideas about completing your own logic model. Obviously what you're focusing on won't be exactly the same as Poplar, who are looking at health and diabetes issues, but the principles that I'll be showing you are the same. Then just a final few slides at the end of my presentation will give you some tips and tricks, as it were, for firstly completing your logic model over the next 6 weeks or so, and secondly what to do once you've got a completed logic model in terms of testing it, trying to pull it apart, for instance. So these are the steps we're going to be going through. As I said, I firstly want to start off with just talking you through what we mean by a logic model. On the screen in front of you, you should all see a diagram. This diagram illustrates how the rPlace team would like each area to set out their logic model. There are lots of different ways of illustrating a logic model. This example that we're using for rPlace is circular. So you start in the top left-hand corner and you work round to the top right-hand corner, going counterclockwise. But there are also logic models which are set out in linear fashion, sometimes vertical down the page, sometimes horizontal across the page. I've given some links to other ways of depicting a logic model in the written guidance that Jim referred to. But as I say, for the rPlace project, we're asking that all areas set their logic model out in this counterclockwise circular fashion. Regardless of how a logic model looks, all logic models have 3 fundamental steps. Firstly, in the top left-hand corner of this diagram, where the conditions box is, a logic model will set out what is wrong. So what we mean by that is, what within our local community do we want to change? Do we have evidence that something needs changing? In the bottom left-hand box of the logic model, you move on to the next step, which is what is going to be done to correct what is wrong. So what is the intervention or the series of activities that are going to be put in place to change what we've identified as being wrong or not being satisfactory within our local area. Then the third and final stage in any logic model, which is the right-hand portion of this diagram, is what will be the outcome of those activities. What will success look like? So we've gone from what is wrong to what are we going to do about that to and what will be the outcomes of what we're doing. Now, many of you probably will have realized that this logic model describes a virtuous circle. What I mean by that is we're starting by saying something's wrong, and we're saying by acting and by delivering various outcomes, we'll remove that issue from being a problem in future. So if youth unemployment's an issue now, by acting and by delivering outcomes for young people, we'll ensure that in a few years' time, in 5 years' time, however long it is, youth unemployment will no longer be the pressing issue it is now. So a virtuous circle is what's described. I'm just going to talk you through the individual boxes of the logic model, because I realise that some of the terms, like rationale or outputs, outcomes, might not be familiar to all of you. So starting in the top left-hand box entitled conditions, and I should say that the descriptions I'm going to talk you through now are included in the written guidance. So in the conditions box, you have local context. What your rPlace area and your proposal needs to put here is evidence of issues within your local area that you wish to tackle. What we mean by evidence is primarily data. So for instance, you might include here data on local unemployment rates or rates of ill health. You'll also hopefully include data showing if the issue is getting worse over time or if the issue is particularly prevalent. So you might benchmark your local area's data against wider local authority data. Say you're working in a ward, you might say, look, the issue in our ward is so much worse than it is at the local authority level. Or you might benchmark yourself to regional or national statistics. So in the local context case, you need to put evidence of what's wrong. You might also put qualitative feedback. So if you've got resident surveys, for instance, where people are saying that they're dissatisfied with particular issues or services that they receive from the public sector. Underneath that, policy context, here you'll need to summarise the local and national policies that are influencing how an area might respond to that issue that you've identified. So a good example here for the rPlace areas is probably the localism bill. So the localism bill talks about giving people greater say over how services are delivered, greater abilities to take control of those services, for instance, and hopefully the localism bill should shape how local authorities consider how services are delivered within their patch. So that's probably something you'd reference as policy context. If you were doing something around benefits and out-of-work welfare, for instance, you'd probably reference DWP's welfare reforms. Well, you'd definitely reference them and say that obviously more responsibility is being put on people to seek work, to be proactive in their job seeking. So in that section of the conditions box, list down the policies that are out there and are influencing how you need to respond, how you need to design your rPlace model. Finally, in this box, you need to answer what needs to be in place for change, for challenges to be overcome. What we mean by this is what behavioural changes or what normative changes, to use a psychological term, need to take place. So do local residents need to adopt new attitudes to managing their health or seeking work? Do service providers need to adopt new attitudes to how they engage with people? So they're not just engaging based upon their service's key area of work, be that health or mental health or drugs and alcohol, but they're taking a wider view of what that resident or what that individual needs. So do there need to be attitudinal changes within services, within residents, to bring about change? Okay, so That's your top left-hand box around conditions. You then move on in the bottom left-hand box entitled Objectives to describe what I call the nuts and bolts of your rPlace proposal. So firstly in this box, you need to set out the high-level objectives of your rPlace program. I'd imagine that quite a few of you in your operational plans have bulleted or talked through 4 or 5 high-level objectives for your program. Some of those are probably objectives for the residents or clients that you're going to be working with, so helping them towards independent living, helping them to improve their skills, increasing their chance of getting a job, for instance. Some of them might be objectives for your own organisation or partnership, so working more closely to deliver better services for residents, for instance. So quite high-level objectives describing what you're hoping to achieve over your 2, 5, however many years it is that you'll be operating. Underneath that, there are 4 boxes which give more detail. They sort of sit underneath the objectives, as it were. In terms of rationale, this is one that people sometimes struggle to understand what it means. But basically, in the rationale box, you need to answer the question, why have you designed your rPlace program as you have? To think of it another way, why will the problem you've identified in the conditions box not go away of its own accord or go away as a result of other public policy interventions? So have you undertaken research and considered the problem you're faced with and realised that the way public services are currently delivered, perhaps it's all over the telephone or there's lots of online services, well, we've looked at that and we know that older residents, let's say, or people who don't have English as a first language, we know that they are uncomfortable accessing services in those ways. So the problem they face won't go away with the way that services are currently delivered. Therefore, let's move towards a face-to-face or embedded within the community approach. That would be one example of a rationale. Other examples, just trying to think of a few here. Let's say that people's mobility, for instance, restricts their ability to access services. So you might say, we're proposing more of an at-home service for certain residents, because that will mean that they can continue to engage with services, shape those services, whereas at present they can't. So in summary, think about the process by which your rPlace proposal will be operating. Think about why you designed that as you have and why it's different from the way that local authorities or GPs or other health service providers currently deliver things. Next in the chain, so the second of the chevrons, is entitled Inputs. This should be quite an easy box to fill in. In this, you need to list the funding, the staffing, the equipment, the facilities that you have at your disposal to deliver your rPlace program. So funding, for instance, obviously there'd be the locality grant in there, but also any match funding that you've been fortunate enough to secure. You'd list the number of staff that you have working on this, whether they are dedicated staff or staff will be spending some of their working week on the project. The idea of full-time equivalents, some of you might come across, so list both full-time and part-time staff. You'd also list in there things like IT, community centres, venues that you'll be calling upon, that you'll be using to maintain, to run your daily activities. So list all the inputs that are going to be needed that are at your disposal. Those inputs will be used on a daily basis to deliver activities. So in the activities box, you need to list things like if you're going to be running community events, if you'll be setting up training courses, you might be producing informational and guidance materials for the community, you might be setting up a website, for instance. So these are the daily tasks, if you like, the to-do lists that the staff who are funded with the inputs are going to be doing. So activities, that's that box. And then finally, in this bottom left-hand corner, outputs. So these are the measurable or quantifiable results of your proposal. They're usually goods or services that are going to be produced in the short term. So let's give you an example to make it a bit easier to understand. Let's say that my inputs are 2 members of staff and a community centre. So a really simple proposal. Activities, I'm going to run community events with those 2 staff. In the outputs box, I might put something like 5 community events, for instance. So short-term, single outputs, I'm going to run 5 community events. And that gives me a target against which, on a month-by-month basis, I can measure my rPlace proposal and say, yep, we've run a community event this week or this month. We're on target to hit that 5 target overall. Obviously, that's a really simple version. For your rPlace proposals, no doubt you've got multiple outputs that you're seeking to deliver. Sort of numbers of people on a training course, for instance, or numbers of people engaging or accessing a website, for instance. But they're short-term, quantifiable results of your activities. Just finally then, to talk you through this slide, we've got outcomes and impact on the right-hand side. So firstly, outcomes. If you're successful in achieving those outputs you've listed in the previous box, then the residents or the clients or the organisations that you're supporting are going to see wider medium to longer term consequences of those activities. And you list those medium term consequences in this outcomes box. To give an example, improvements in residents' long-term health would be an outcome. Likewise, young people entering sustained employment would be an outcome. Just taking that latter example about young people entering sustained employment, let's say that one of your outputs was to broker 50 apprenticeships with local businesses, something that one of the pilot areas focused on last year. So the output would be 50 apprenticeships brokered, and the outcome would be, let's say, 35, 40 young people entering sustained employment. So in the medium term, not all of those apprenticeships would necessarily create a sustained job. Some people might not finish them, for instance, or decide they want to do something else. But a number of those young people on those apprenticeships would then go on into sustained employment and starting their career. So that would be the medium-term consequence for them, sustained employment. Other examples of outcomes I put in the written guidance, things like more people volunteering within the community, more people feeling they have a greater say in local service delivery. Those would be examples of outcomes. Finally then, intended impacts. So if you achieve those outcomes for the individuals or the clients that you're working with, then broadening it out again, you're going to be having a positive impact upon the wider contextual factors or issues that you identified at the start of your logic model in your conditions box. So to go back to that apprenticeship example, so you've got 50 apprenticeship outputs which have generated 40 young people in sustained employment. That's the outcome. Then the impact would be a reduction in the youth unemployment rate. So if you think it through, the reduction in youth unemployment wouldn't have just been caused by the rPlace program. There would have been wider economic factors, such as a pickup in the economy or national government schemes that might have influenced the youth unemployment rate. That your rPlace program will have been a contributor to that improvement in the youth unemployment rate. Other examples of impact would be things like lower local hospital admission rates or lower levels of A&E attendance, an increase in the volunteering rate. That would be another impact. To explain the difference between outcomes and impacts, a few weeks ago at the Birmingham session, one of the attendees put this really nicely. She said, upon reflection, outcomes are the things that we are going to be measuring. So we're going to be measuring from our residents or our clients, whereas impacts, they're the things that other people, other agencies will measure. So if we measure X, then the local authority might measure Y. And what we're measuring will impact upon what the local authority finds from its stats, but we won't be producing those. So think about it in that way if it helps. But as I say, there's more written guidance around this which should make the distinction clear. Okay, so that's talked you through the different stages of the logic model. I'm just going to move on now to talk you through the worked example that we'll be using today to illustrate how you complete a logic model. On the slide in front of you, I've put some detail on the Poplar Neighbourhood Community Budget. For those of you who haven't heard from Sarah Castro and the team down in East London, this is just a summary of what they were faced with. So they're operating in 2 wards in Tower Hamlets, Bromley by Bow and Mile End East, both of which are highly deprived wards, as you can see, and both of which have a high Bangladeshi population. The Poplar team did a fair amount of research, both secondary research looking at data and primary research, so things like street surveys, and they identified that poor health was a real challenge for the community. So they saw that they had very high rates of diabetes. So Tower Hamlets had an above average rate of diabetes, and within the 2 wards, diabetes rates were higher still. And linked to that, they also had higher rates of what are termed comorbidities, so things like cardiovascular disease, for instance, and obesity. So they identified that that was a key problem they wanted to tackle through their neighbourhood community budget, and they identified that the key issues caused by those underlying factors were lots of people being diagnosed with diabetes, lots of people being admitted to hospital with diabetes or turning up at A&E with a crisis issue relating to their diabetes, and also finally that those people who were admitted to hospital were staying in hospital longer, when all the evidence suggests that people prefer to be discharged as soon as possible. So those were the key challenges that they identified. In terms of a response, the Poplar team have developed the concept of care packages. Care packages are built around what's known as social prescribing. That's the idea that anybody should be able to go to their GP with a health issue and firstly receive expert advice on their health issue, and advice around medication, for instance, but also for the GP to take some time to understand what are the wider factors in someone's life that are causing that ill health. So it may be something around mental well-being, it may be something around money management and debt, it may be something around skills and opportunities to secure employment, because there's lots of evidence showing that those wider contextual factors are strong determinants of someone's health. So the Poplar team developed this approach where someone would go to one of the local GPs, or clinical commissioning groups as they're known now, they'd receive some support and they'd be referred to a local volunteer who would take the time to get to know that person, to identify the further support needs they have, and to help that person access the support, either at a local community centre or at a local college, for instance, if it was around training that they needed. So the volunteer would support that person for a year, and hopefully the outcome of that would be better management of health, fewer diabetes issues, etc., etc. So that's just a run-through of the Poplar Neighbourhood Community Budget. There's more detail on this on the My Community Rights website if you want to refer back to that after the webinar. Okay then, so let's think, how are we going to fill in our logic model based on what I just told you about the Poplar example. So going back then to the blank logic model that we have in front of us, when you're reading a logic model, you read it you read this one, for instance, in a counterclockwise fashion. So you start with conditions, then you go down to objectives, then outcomes, then impact. When you're filling in your logic model over the next month or so, it will probably be easier, though, to start with your impacts and then work backwards. So you say, what is the change that we want to see, that we want to deliver within our local community? Okay, to deliver that, what outcomes do we need to offer to our local residents or the clients that we're working with? Okay, what outputs and what activities need to be in place for those outcomes to be achieved. What inputs, what funding, what manpower will we need to resource those activities? Going back from that, what's the rationale for running these activities? Why a current service is not doing this? And then going back further still, what's the policy context that these activities have been shaped by? What's the local context, the evidence that proves that these activities are needed? So it's often, as I say, easier to fill in a logic model by starting at the end and working backwards. And that's how we're going to fill in today's logic model using the Poplar example. So starting in the top right-hand box, intended impact, which should have just gone grey on your screen. So intended impact, the Poplar team, as I say, had done some research around this, and they said, well, the number one intended impact is around fewer hospital admissions for diabetes. That's what we know is the real key driver of cost within the public sector, within the NHS locally. So we want to reduce hospital admissions for diabetes. We also want to make sure that if people are admitted to hospital, that they are in hospital for a shorter period of time. Linked to that, we'd also like to see an improvement in our health metrics. So we'd like to see fewer percentage of the local population being classed as obese or overweight. We'd like to see a greater percentage of the population taking regular exercise or saying that they have a healthy diet. With the social prescribing model, we also think we've got a chance to influence skill levels. So we'd like to see an improvement in the skills profile of the two wards. And we'd like to increase the employment rate. So we'll be advising people on training opportunities, and they should be able to use those training and qualifications to get a job. Finally, we'd expect to see improvements in community satisfaction with services. So if we run a regular resident survey, let's say once a year, we'd expect to see those saying that they felt they could influence local services increasing over time. So in the top right-hand box there, I've just summarised those impacts that the Poplar team were targeting. Underneath that then, so what are the outcomes that the individual residents who are going to be receiving those care packages, what outcomes do they need to see in their lives to affect those impacts in the top right-hand corner? Well, firstly, if we want to see fewer hospital admissions for diabetes, that suggests that outside of hospital, people will be better managing their care, better managing their diabetes, I should say. So better management of diabetes in the home. That's the number one outcome that's being targeted. We'd like, Poplar team said, we'd also like to see reduced usage amongst that client group of the NHS. So not seeing A&E or doctors as the first point of call, but rather seeing the volunteer support they have and their own skills and knowledge as the first port of call. We'd like them to have increased awareness of how to manage their health and how to have healthy lifestyles in general. Linked to that, the Poplar team was also aware that lots of these individuals who had diabetes or at risk of diabetes were putting demands upon their near family and friends in terms of caring responsibilities. So they hope to see amongst the residents they were working with less need for carers. So those carers could then use the time that was freed up to do other things, whether that's economically active things or other volunteering tasks around the community. And they'd also like to see wider outcomes for residents around gaining qualifications, sustaining employment, more people volunteering, generally more community engagement with local healthcare providers, for instance. So those were the outcomes that they were hoping to see as a result of their activities. So I've just highlighted those, I've written them down rather, in the intended outcomes box. Now, I realise I've talked you through quite a bit there, so we're just going to have a break now and we're going to launch one of the polls that Jim referred to. The first poll that we've put in is, do you have a clear idea of the outcomes your programme is seeking to deliver? Jim will be launching that poll, it's on your screen now, and what we'd like you to do is to vote on that so we get an idea of how many of you, what percentage of you have a clear understanding at the moment of your outcomes. So a third of you have voted so far, just coming up to half of you have voted, yep, roaring away, 80%. Just a bit of you to go. A little bit longer. Still a few of you to vote if you haven't voted. Not scientific, so don't worry if you're not quite sure how you're going to answer. 90% of you. Just leave it open for a few more seconds, Jim, just so we can see if we can get some more votes in. At 93%. Who's outstanding? A few of you, maybe. Okay, let's if we can close the poll now, Jim, and launch that on people's screens with the share button. So this should be, the results should be coming up on your screen. There it is. Yep. So as we can see, good to see that a good just over 40% of you have a clear idea of your outcomes. Just need for a quarter of you or so just to get that signed off by the wider partnership, and it's good to see that another 50% of you have made some good progress in terms of identifying those outcomes. So hopefully filling in those two parts of your logic model should not be too difficult or daunting. To the sort of 8 to 10% of you who are still working on those outcomes, you're not sure of them, hopefully the examples I've included in the written guidance will give you a feel for what you need to be talking about in terms of are these our outcomes, are those our outcomes, for instance. Okay, that's good to see, and it's sort of in line with what we got in the first webinar last week as well. So I'm just going to hide that poll and take you back to my screen. We're now at a question break, so I'm going to hand over to Jim, and Jim's going to just run through some of the questions that will have been posed in this first 20 minutes or so of the webinar. So if I can hand over to you, Jim, for a summary of questions.
Okay, thank you, David. Couple of questions from Neville. Why is the logic model structured the way it is?
Okay, I hope, Neville, that the way I've talked it through to you, well, the way I was talking it through, I was trying to explain that, yeah, so a logic model is a necessary simplification of an issue and a response to an issue. I'm not going to claim it, and I'm sure other evaluators wouldn't, but it describes the full range of things that go on within a community or within society to affect a problem. But what you're trying to do in a logic model is distill down your program into some easy to understand steps, to saying this is the problem that our program is fixated on or is concerned with. This is how we've designed a response to that, and why we've designed our response in this way, the rationale box that I described. And then simply explaining to, let's imagine it's a casual reader who doesn't know anything about your R-place model until they see your logic chain, and then saying on the right-hand side, and this is what we're hoping to achieve. So it's by boiling the logic, by boiling the program down to those stages and this diagram, as I'll show you at the end when we've got a completed logic model, it's really helpful because it helps an external person say, okay, so the logic underpinning this area's work is that by doing these activities, you can deliver this many outputs. Okay, so I can test that, and I can ask questions, and I can look at the recorded performance to see if those numbers were created, or there's a rationale here that by delivering services in this way, you'll deliver these outcomes. So if I speak to residents, I can ask them specific questions about these outcomes. So it gives me, or anyone external looking at your proposal, a nice simple way of testing it, of pulling it apart, comparing it to other programs and other logic models. So I hope that's managed to sort of start answering your question. It's, as I say, it's a simplification of real life, if you like, which gives us a basis for evaluating what you're doing. Any other questions, Jim, that you want to put to me?
Yes. What's the difference between this and the theory of change model from Julia?
Okay, so in summary, we had this question with the relationship managers on Wednesday as well, and what I'd say is a logic model is a simplification of a theory of change. Linking back to my answer to Neville's question, a theory of change will describe a whole range of factors that might influence an issue within an area. So if you identified youth unemployment, for instance, a theory of change might describe what an R-Place proposal wants to do around youth unemployment and why it's designed as it is, but it would also bring in the wider influences of youth unemployment. So you might start talking about national skills policy and funding, and saying, you know, there's greater incentive for employers to train up their existing workforce than to bring on an unemployed young person. You might talk about wider societal perceptions of if it's better to employ a young person or an older person. So you go into a whole range of other factors that influence whether youth unemployment goes up or down. And not all of those factors would be within the control of your R-Place program. Theories of change are also often written documents. You know, they're not long theories, but they're written down. A logic model simplifies that and makes it, obviously it makes it into a diagram, which hopefully a casual reader can be more engaged with. So in summary, it's more simple and it's in diagrammatic rather than written form. Any more questions?
Okay, thank you, David. Yes, there's 3 or 4 others. There's 2 or 3 questions around community engagement. I'll just read one of them from James. R-Place promotes bottom-up working, i.e. the community should define its own outcomes. We are continuing extensive community engagement at various levels. Is pre-setting outcomes at this stage top-down? So where does community engagement slot into the logic model?
Well, I fully agree with that statement. Obviously, R-Place is a sort of bottom-up. It's in line with the localism bill about communities taking control of what changes they want to see. And you know, you often hear people saying, "Don't do your outcomes to me. Let me generate my own outcomes." I mean, I'd suggest that R-Place proposals to get to this stage, presumably those community engagement mechanisms are in place or are being developed, and you know, I think it would be incumbent upon R-Place areas to get some community input into what those outcomes are over the coming weeks. I would also suggest that I doubt that the outcomes that let's say teams, you know, not communities, that the outcomes that teams think are relevant. You know, if you are truly representative of your community, and from everyone I've met on the program, I think they are. You know, it's people coming from the community rather than local authority necessarily, then surely you should have some understanding of what the community say they want and they need already. So be confident to put that down on paper, to test it with communities throughout August if you can. But you know, if following the deadlines that Jim's going to talk you through, that the logic model changes slightly, that's not the end of the world. I'm sure your logic model by early September will be a good reflection of what the community wants, if not the complete one. I hope that helps as an answer.
Okay, couple more. Sue is the program for Ashbrow has several themes which will require the completion. Will this require the completion of several logic models, or will one do for all of them?
This question again has come up in both the previous webinars, and my response is it depends upon whether you have a sort of single set of activities that will deliver multiple outcomes for one group of residents, or if you're going to be delivering discrete activities for different groups of residents which will lead to different sets of outcomes for each. So if, for example, you're just going to be working with, let's say, older people and delivering a range of activities that will lead to a range of outcomes, you could probably put that in one logic model and say, you know, we're working with one group or cohort, as they're sometimes called in technical terms, and so long as your logic model can show and these activities flow through to that outcome, these outcomes, that's fine. But if you're in the latter example, where you're dealing with, let's say, older people in the community, teenagers, people from a certain ethnic group, and you're dealing with them in different ways, i.e. different activities and different inputs, then having several logic models would probably be clearer. Because somebody might look at it and say, how will running events for teenagers in the local community hall, how will that improve elderly people's sense of engagement with services? It would confuse the casual reader. So putting those onto separate logic models would probably be easier. I should have said, actually, in the logic model diagram at the top, there's a project title box. So you could put, your project name dash older person's theme, or dash long-term unemployed theme, or whatever your themes are. So yeah, don't be afraid of creating 2 or 3 logic models if you think that's the easiest way of understanding your proposal.
Okay, last couple of questions. From Bill, isn't the output mainly the operational plan?
Sorry, I don't understand the question there. In the outputs box, what you'd be listing is not that we're going to produce an operational plan on the 1st of November, but if our operational plan goes live, then the outputs of our operational plan will be community events, website, grants to local voluntary organisations, whatever it is your RPlace proposal is about. I mean, sorry, I can't be more specific because obviously lots of RPlace proposals are doing lots of different things.
Yeah, sorry.
Yeah, you go ahead, Jim. Sorry.
Okay. Yeah, I mean, I think the outputs it is a sort of key constituent of the operational plan, but also all the other elements that David has made reference to are equally important. So knowing what the context is, what the environment is, knowing what the intended inputs are from each of the partners, and knowing what the outcomes are all potentially equal standing in the operational plan, and it's the outputs are one element of what will make your operational plan. Just with respect to the operational plan, we met with the DCLG this week, and we are looking to get guidance out to you very shortly. It's unlikely that it will be a template at this stage, and for those who attended the events in Nottingham and London and saw the presentation from Camilla at the DCLG, the guidance is going to be very much based on that presentation. So it's very unlikely there's going to be a template, but we will be offering guidance out there which has a degree of structure. Okay, I think that's it for the questions for now. Any we haven't addressed presently, we'll look to address at the next question and answer session. So I'll hand back over to you, David.
Okay, thanks, Jim. So to remind everybody where we're up to, we had completed the first 2 boxes of the logic model for the Poplar exemplar, and now we need to fill in the bottom left-hand box around objectives, rationale, inputs, activities, and outputs. In terms of the outputs that the Poplar team set themselves as targets when they started 18 months ago or so, the primary output, and again this is a simplification given the space and time we have today, but their primary output was around the number of care packages that the GPs were able to produce and the volunteers were able to support. So they said, we'd like to produce 2,000 care packages over the lifetime of our project. So 2,000 individuals, if you like, with diabetes or at risk of diabetes will be put onto a care package. They also said another output that they listed was around training courses. So they'd like to see 300 individuals complete a training course as a result of their RPlace pilot. And another output they had was around the recruitment of 50 volunteers. So 50 volunteers to support the people on care packages. Remember, not all those 2,000 would be on a care package at exactly the same time. So the 50 people would have a rolling client list, if you like. So just a summary there of some of the outputs they were aiming for: care packages, training courses, numbers of volunteers. Simple, enumerated things that obviously they can track their performance against on a month-by-month or a quarter-by-quarter basis. In terms of the activities that are ongoing now within Mile End East and Bromley by Bow as a result of the pilot, so the first of these is around the development of care packages. That's a day-to-day activity that the clinical commissioning groups for GPs are involved in. There's also work around supporting the volunteers. Lots of those 50 volunteers are new to the idea of social prescribing. They might be new to the idea of peer support and volunteering in general. So it's recognised that they need some day-to-day support from staff who with expertise in this area. There's obviously the training courses that are run at the local community centre. If somebody's referred on to a course to develop their skills so they can get into work, those courses are run. There's also publicity around the activity, so alerting to people that they can access this wider source of support, telling them, speak to your GP about this next time you're in for a regular checkup, for instance. So some of the day-to-day activities of the Poplar team just listed there in that chevron. In terms of inputs, the Poplar team, they're quite fortunate in a way that the local housing trust, so that's Poplar Harcar, they have contributed staff time to the pilot. So I think it's 3 members of staff within the housing provider work on the pilot on a full or part-time basis. There's also additional time input from GPs. So above and beyond the usual contact time that GPs would have with an individual with diabetes or at risk of diabetes, there's about an additional half an hour that the GP will take to work out that person's wider needs and to develop a wider care package, a package of support for them. The GP time is an input. There's volunteer time as well. Those 50 individuals who are supporting people in the community, they could be spending their time on other programs. They could be economically active and actually working, so that needs to be noted as an input for the project. There's use of the community centre. That's been given free of charge to host community events and publicise the work of the pilot. And there's also been various grants and funding. The Poplar team were fortunate as a pilot to get a slightly larger DCLG grant, and they also got some funding from DWP as well. So in terms of inputs, just summarised there in the box, RSL time, GP time, etc., etc. The rationale box, so if you remember, this is, why is this intervention needed? Why will it not go away of its own accord or thanks to other interventions? So the Poplar team looked at the situation they were faced with and they said, well, firstly, we know that diabetes is very prevalent within these 2 wards, more so than within Tower Hamlets in general, more so than within Greater London as a whole. So we've got higher prevalence of diabetes and it's getting worse. So mainstream services don't seem to be coping very well with this issue. So that's one reason why a new approach is needed. Secondly, we've done some research and we know that there are multiple causes of ill health. It's not just necessarily someone's diet or exercise patterns. It might also be their home environment, their work environment, their mental well-being. All of these can influence someone's health and risk of diabetes. So let's design a system that addresses all of those determinants of health. Because at present, we're all working in a siloed approach and no one person can give that wide-ranging advice. They also thought that if we can develop this volunteer-based approach, then we'll be able to give tailored support to individuals. That volunteer will spend time getting to know someone's health issues and the causes of their ill health, and they can give a tailored solution to those problems. So it won't just be trying to put, as it were, square pegs in round holes. It will be a tailored response, and if you can tailor the response of services to someone's needs, then they're more likely to stay engaged with services. They won't get frustrated and say, this isn't solving my problems. They'll see that they're being listened to, they're being responded to. So rationale, just summarised there in the box, 3 key reasons why the Poplar team have designed their projects as they have. Just finally then, in this section of the logic model, some high-level objectives that they set themselves at the outset. So the first high-level objective, sort of combining some of those outcomes and impacts into sort of pithy statements, if you like. So firstly, they wanted to deliver the concept of care packages and to do this with community support. Secondly, they wanted to develop a more cost-effective way of managing the community's health. So their research had indicated that it's very expensive if someone is admitted to hospital with diabetes and has to stay in hospital for a length of time. So the pilot is about developing more cost-effective ways of managing diabetes and managing health more generally. And thirdly, and this is what I talked about, a process objective. So they wanted to develop a model of managing healthcare which could then be rolled out, could be scaled up, could be replicated, whatever management jargon term you want to use, a model that could be replicated elsewhere in Tower Hamlets, elsewhere in London and nationwide. So just summarised there some of the programme objectives that they put in their business case that they'd used to explain the approach they were taking to a casual observer, a casual reader. Okay, so I think we're at the point now where there's another chance for questions. So Jim, since we last had, I know there were some questions outstanding, but have any more questions been put that we need to answer now?
Yes, a couple of questions. One, the first from some Mathy. I got the impression that the outcomes box needs to include quantified outcomes. David gave an earlier example of the number of young people in sustained employment as an outcome. However, the Poplar example doesn't have quantified outcomes. Which approach is preferable?
The question's quite right, and one of the tips I give at the end of the webinar is about getting as many numbers as possible in. The Poplar team, as I understand it, they do have targets for those outcomes. It's just the simplicity, and in developing a slide, I didn't include those numbers in that box. But my advice to everyone listening in would be, yes, try and quantify your outcomes along with quantifying your outputs.
Okay, thank you. Question from Neville. Sorry, just bear with me a second. Outputs to outcomes implies a fairly sophisticated evaluation process. What resources are there to help projects, and why is the AllPlace program not being evaluated? I can answer a couple of those questions. The AllPlace program that we are currently delivering is not being evaluated in the sense that when locality complete this round of the AllPlace program in March 15, then we don't have to produce an evaluation report on how we've managed the program and what the outputs and outcomes were. I believe this is unusual from my experience of managing programs and projects, but I believe this comes from Eric Pickles, MP, who sort of heads up the DCLG, and he doesn't see he doesn't hold great stock in evaluating programs. However, with respect to actually evaluating the impact of areas and services delivered through the AllPlace program, particularly from the pioneers in the 12 pioneers in the first round, and then also with the 120 plus areas in this round, then the DCLG are very keen on evaluating what impact they have in the areas and how it promotes localism. For example, last week there was a meeting at the DCLG with Stephen Williams, one of the ministers from DCLG, with all of the pioneers the 12 pioneers from the first phase of Our Place, and they were feeding back to him their experiences in delivering projects, and particularly in now trying to implement their operational plans. So the DCLG, although we're not evaluating this specific delivery of the Our Place programme, they are evaluating, and they will be evaluating, all of the operational plans during the course of next year to gain learning, and also to does the sort of this approach, does it work? Because what they're proposing to do is to replicate this again next year from March 15 onwards. They've put a strategy out and proposals out for Our Place next year, and they are looking again to work with potentially another 140 areas. So any learning from this programme, it's critical that feeds into other areas who join the programme in the future. Okay, so hopefully, Neville, that answers your question on the evaluation. There was an email from Jeff, sorry, a question from Jeff, which was quite lengthy, but I think in essence, Jeff, you're querying the validity of doing this and whether or not it's an exercise that is of use. I believe it is, and the discussions that we've had with key partners and with the DCLG, the discussions have led us to the fact that we do think this is an action that benefits everybody. I mean, with respect to the CBA, as I said in the introduction, we are, we're slightly fearful that areas may potentially be doing more around CBA, investing more time and resource than is actually required. So the purpose of doing this logic model is to get a feel for what is proportionate, so we can go back to areas and say, actually, you don't need to invest £2,000 of your 10,000 with CBA. You don't need 5 days CBA direct support, because what you're proposing is relatively straightforward. So you can potentially use those monies or that direct support on another element of your operational plan. Actually doing the logic model, we believe that as a minimum is a couple of hours work, potentially an afternoon's work, and shouldn't be too much more than that. So again, we hope that your investment in time, in the early stages of the operational plan, will save you time going forward. We also think that the logic model has benefits beyond CBA, in that it is providing, again, at an early stage, the opportunity for you to focus in on what it is you're actually trying to achieve with your operational plan. What are the outcomes? What are the outputs? In assessing all of the development strategies, a lot of areas are still quite broad in what they're trying to achieve. And going forward, areas need to focus on exactly, 1 or 2 or 3 elements, where currently they may have 6 or 7. So in a way, doing the logic model, we're trying to get some areas to sort of come off the fence and make those sort of difficult decisions earlier rather than later, and provide you with hopefully a clear focus at the start of this next phase. It's a live document, so it's something that you and the partners can revisit during the development of your operational plan, and hopefully having that clear message about what it is you're trying to achieve on a single logic model will provide that focus going forward. So for that reason, we don't feel that it's a wasted exercise, and we do feel that there is real value in doing that. I don't know, David, if there's anything you want to add.
No, I think that's a very fulsome and accurate answer, Jim. Yep.
Okay. Thank you. And just one more question that I'll answer now. Okay, Emily was asking, can we include qualitative outcomes in the logic model?
Yes, very much so. So I know I stressed the importance of getting numbers in there in terms of your outcomes as well as numbered outputs. But that doesn't mean you can't have qualitative outcomes. I'd fully recommend that as many RPlace areas as possible once you go live next year, if you get the green light, that you plan to get regular qualitative feedback from the residents, the communities that you're working with. Whether that's through a regular community survey, whether that's through regular feedback sessions and focus groups, whether it's street surveys and vox pops as they're sometimes called. In all evaluation that I do, I always try and mix quantitative and qualitative analysis, because either one on their own doesn't tell you anything really. You need to combine them. So yes, have qualitative outcomes in there as well.
Okay, a question that I can answer from Pat. It's still unclear how we can complete this by the 1st of September, when the funding is designed to help us develop an operational plan by November, and we'll be doing a lot of work to develop and design solutions in September. Yeah, I mean, we have sat back and thought carefully about the correct timing to do this. Obviously, we appreciate that August is a holiday period, obviously not the whole of August, but in relation to getting partners in common dates that you can sit down with partners. So we thought September would be realistic rather than having it in mid-August. There's still a number of areas yet who haven't been awarded funding for phase 2. So if we get back to you at the beginning of September, and the plan is that there'll be an expert panel that will sift through your logic models, that you'll have at least sort of 8, 9, 10 weeks to continue with your CBA, but we do appreciate that during August you may be moving forward with your operational plan in some way, shape or form. With respect to CBA, if you do have an urgency to move forward with this, I would suggest trying to hold back until beginning of September. But if you feel this is unrealistic, then by all means give me a call and we can discuss it. What I'm slightly nervous of is areas who have invested £2,000 and 5 days direct support, using all of that during August, when it may not be proportional to what you're trying to achieve. So I hope that answers your question. But I say if there's any issues, then take that up with me after the presentation, and we can have a discussion on a case-by-case basis with any area during the course of next week. Bill's asking whether we're getting a template logic model to fill in. Yes, you will. There are slides already available on the website. I'll need to check. They may be PDFs, so it may be that I need to send all areas. There will be a message going out next week to all areas about the requirements for the logic model, and that will include a template that you can that's in Word and you can easily update electronically. Let me just see if there's any more questions. Yeah, again, Bill's asking, timescales are presently pretty difficult. I think this is in view from the vast majority of participants in RPlace. Again, Bill, I think I answered this earlier. We believe that this is only an investment of at the most half a day of your time. And we believe that between now and the beginning of September, there's at least 5 weeks. And we'd hope that you could identify half a day in those 5 weeks to put together the logic chain. We appreciate that some of the partners will not be available. The idea is if all partners aren't available at a particular date, that if you get the majority of partners together, particularly any partners who may be more critical than others, then you can have that discussion, you can start to complete the logic chain, and then potentially if other partners are away on annual leave, they can then have a look at a first draft when they return, and they can have an input at a later stage. So we hope during that 5-week period you and the partners will find sufficient time to complete the logic chain. Sorry, just to confirm from William, the deadline is the 1st of September, and again I will go through later. Okay, I think that's enough questions for now, and there is another opportunity towards the end of the session. So David, again, I'll hand back to you.
Okay, thanks Jim. So just to take us through the final bits of my slide presentation, so to return to our Poplar example, we've just got the one final box to complete, and that's around the conditions that the Poplar team were faced with. In terms of the local context, so here, as I mentioned earlier, they did quite a lot of analysis in terms of rates of diabetes within the 2 wards. I think off the top of my head the number was 6.4%, wasn't it? Sorry, I'm just referring back to my other slide. Sorry, 6.8%. And they benchmarked that and said, look, it's 4.6% elsewhere in Tower Hamlets. They showed that the issue was getting worse. They did research with the local NHS acute trust, so the people who run the hospital, as it were, to work out how many people were being admitted to hospital with diabetes-related illnesses, for how long they were staying in hospital, for instance. So they did quite a lot of research on health statistics. They also looked at deprivation statistics. So what do national data tell us about things like child poverty, the numbers of people who are out of work in our local area. And they also looked at the issue of ethnicity, and by identifying the large Bangladeshi population in these wards, what might that mean in terms of their willingness to engage with public services and how public services need to respond to them. So that was some of the local context I identified. In terms of policy context, so obviously one of the key ones I identified was around pressures within the NHS, noting that very expensive to keep someone in hospital, especially if it's longer than they need to be in hospital. So we need to develop ways of managing care in the community. They looked at changes around GPs or clinical commissioning groups, to give them their official term, how they have greater say over how healthcare is delivered within the community. So by putting GPs at the centre of this model, they were very much chiming with that development. And they also looked at things like the Well London initiative, which is around, what are the wider determinants of the health of people in London. It's not just about the narrow health indicators that previously we might have looked at, but it's wider things around quality of housing, people feeling engaged and neighbourly, for instance. So that wider well-being agenda. So those were some of the things they referenced. And then finally, what needs to be in place for change to occur. So the team said, well, what we're trying to do with this project is not just, deliver 2,000 care packages. It's about a mental change within the community and within service providers, so that firstly, the community takes more responsibility for proactively managing their health and not seeing the first point of call as the A&E, for instance. But secondly, it was also about giving people and communities the information and the opportunities and the support to be able to take control of their health. So giving them the advice, but also giving them the access to things like training courses or advice on who else could support them. So they're not just being told, look after your health better, but here's how you can look after your health better. So those were the attitudinal changes that they were hoping to drive more fundamentally. So I've just summarised those there in the top left-hand box. So now we have this completed logic model in front of us. Just before we have a chance to address some of those final few questions, I thought I'd just give you a few tips on how you can get to that good logic model. Some of these tips probably have already come out in answers to questions. But firstly, so when you're on the pathway to completing your logic model, so over the next 5 weeks or so, the first tip is really involve as many stakeholders as possible. Now, I know some of you have put the point that, it's August, people aren't in the office always. And what I mean by that is not necessarily you all have to be sitting around the same table at the same time. You could involve partners through an electronic process. So one agency or one group could start the logic model and then send it around for comments, or another agency could take over the logic model. But by involving as many agencies as possible over the next 5 weeks, you'll be able to get a really rounded view of what your program's about. You may at present be sitting within a certain organisation who are focused on a specific issue, whether that's drugs and alcohol, whether that's around older people, whether that's around refugee support, for instance. And it's natural that the outcomes and impact that you're hoping to see from the rPlace project will probably relate back to what your organisation does on a daily basis. But if you can involve more people in the logic model process, you can build up a more rounded view of what your proposal is seeking to achieve. I've mentioned already, include as many numbers as possible. That's useful firstly for further down the line when you're tracking your performance. You can see, we said that we want to deliver 100 of those outputs. Are we on target, yes or no? If you're not on target, what do you need to do to get back towards that target, to get back on track? And it also gives you a chance to think of scenarios, if you like, so saying, what happens actually if we get twice as many people coming to us for support? Have we got the resources? Looking at those inputs that we've got at our disposal, are they enough to meet twice the level of demand? Or what happens if we don't manage to deliver that number of outcomes? We do some initial evaluation or monitoring and it shows that it's not quite working out the way we hoped it would be. What is our plan B? How would we change things? So that's why having numbers in your logic model is really useful. Once you have the logic model sort of in a good state, make sure that you check it. Because by checking it, firstly, you can test amongst yourselves and with external partners, is this plausible? So the logic that we describe here, saying that if we do this, it will lead to that, and as a result, we won't be faced with this problem anymore. Put that in front of someone else and say, does that seem sensible to you? Can you see that by doing this activity we'll deliver those outcomes? And they might turn around and say, no, that doesn't seem clear to me. Surely the outcomes that you're going to be delivering are these, and broaden your understanding of what you're trying to do. Secondly, that point around, is it doable? So I just touched upon that a bit with the numbers point, but you can have, by having it set out in front of you on a piece of paper or electronic format, you can start asking yourself some hard questions about, do we really have the resources and the time and the budget to deliver this many activities? Or, do we need to go and beg, borrow and steal some more resources to meet our ambitions? And underneath that, and I think this links to the answer that Jim gave to one of the previous questions, and one of the real values of having a logic model is that you can, from the outset, plan how you're going to test and monitor your program. If you start a program without a logic model, without a clear understanding of what outcomes you're seeking to deliver, then you can deliver the best program in the world, but it's very unlikely that you're going to know how to monitor and evaluate that, because someone coming in external would say, okay, what were you hoping to achieve? Don't know. Okay, right, I've just got to go and ask general questions of people. But if you have a logic model down from the outset, you can say, right, these are the outcomes that we're seeking to deliver. Okay, where are those outcomes recorded, or how might we record them? Right, we need to design a residence survey, or we need to make sure that every event we run, we have a short opportunity for people to give feedback. Whether that's a short form, or we just speak to people, or run a focus group session or whatever. So by having those outcomes agreed from the outset, you can plan your monitoring and evaluation, and then it's far more likely that that is then actually going to take place. And then when your rPlace activity comes to an end, you'll have a wealth of evidence showing the good work that you've done, the differences you've made to your community. And that evidence won't just be qualitative evidence of people saying, you know, yes, this was good, or it won't just be you saying to the local council or local health provider, you know, we've done a really good job. You'll have independent data, you'll have external qualitative evidence confirming that what you've done has been valuable. So I'd suggest by having a good logic model now, you'll be making it far more likely that you'll be able to demonstrate your success down the line. And then finally, that point around meaningful. So again, share the logic model with partners and say, you know, have we just become fixated on an issue? You know, do you also think that this is an issue within our local area? You know, and if they agree, then obviously you've got a wider case, you've got wider support for progressing with your Our Place activity. So in summary then, when you're developing your logic model, try and do it in a partnership as best you can over the next few weeks. I mean, once you've got a good version of it, try and test it with other people. You know, you might not be able to do that before 1st of September, but in September, see that as a chance to refine your logic model. Remember, a logic model is not set in stone. It can develop over the course of the program as you learn new things about what you're doing and the impact it's having on residents' lives. Just finally from me, I just wanted to talk you through how having a good logic model in September should help you if it's required that your area produces more detailed cost-benefit analysis. As Jim said, not every area will be required to produce cost-benefit analysis of their proposal, but some of you will. And if you've got a good logic model, it makes cost-benefit analysis so much easier, as I'm just about to illustrate. So on the screen, you can see the diagram of the scales. On the left-hand side, the costs of a proposal, and on the right-hand side, the benefits of that proposal. And what every public program is hoping is that the value of those benefits will be more than it costs to run that program. So how can a logic model help you answer that question, you know, do benefits outweigh costs? Well, if you think about it, the 3 boxes in your logic model entitled inputs, activities, outputs, information that you're likely to be putting in those boxes, from that information you'll either directly or indirectly be able to work out the cost of what you're proposing. What I mean by that is, in the inputs box, you might have some clear monetary values. So, such and such an agency is committing £50,000, or we're going to get £15,000 grant from this third sector organisation, or we've got the value of the Our Place programme grant in there, for instance. So, simple numbers that you can quickly total up. Alternatively, in boxes like activities and inputs, you may have things like 2 members of staff, full-time support for the programme. Very simple to quickly work out what's an average salary for that member of staff. Okay, that's the financial value of that input to this programme. Likewise, outputs. You know, if your outputs are around, let's say, you know, developing 50 apprenticeship opportunities, take us back to that original example, there are very easy to access national documents saying how much an apprenticeship costs. An agency called the Skills Funding Agency will spend, you know, X thousand pounds on every apprenticeship. So there are tools and techniques out there, and we can signpost them to you to them, and relationship managers can as well, which quickly enable you to turn your activities, your outputs, your inputs into a cost figure. On the other side of the scales, benefits. So in your intended impacts and intended outcomes box, you'll have things listed like people entering sustained employment, so getting off out of work benefits, or people reporting an improvement in their mental well-being, or people, more people with higher level skills, for instance. Again, if you've got those listed down there, there are models and there are tools out there, which again, those areas you need to undertake CBA will be signposted to, which can very easily turn those into pounds and pence figures for you. So we know how much it costs to have 1 fewer hospital admission, for instance, or 1 fewer attendance at A&E. We've got databases and documents which can work that out for you. So if you can list down your impacts and outcomes in a clear fashion, Further down the line, later in the autumn, it should be easier to start turning those into pounds and pence figures to weigh against your costs. So what I suggest is, if you can get a good logic model now, it will save you some pain further on down the line. But don't be scared about CBA either. I know some of you probably will have come on the York session that Julian and I ran recently, and there's also going to be events at the end of September where we talk people through CBA in more detail, a full-length training, a full-day training course, which hopefully should make it less scary. So that's about it from me in terms of detail. We're just going to now launch a second and final poll, and this is saying, well, based on what you've heard over the last hour and a half or so, do you now feel ready to complete your logic model? So Jim should be launching this poll on your screen any second now. There it is. And could I ask you all to vote as you did last time? Okay. So we can see just over half of you have voted now, 2/3. Okay, 70%, 3/4. Give it a little bit longer to give more of you a chance, 80%. Okay, getting there. Give another 10 seconds or so, just for the final few of you to have a chance to vote. Okay, so that's 90% of you have voted. So it's obviously 10%. Oh, 93%. So that's really good. If we close the poll now, Jim, I think that's a good number of responses, and the results should be coming up on your screen in a minute. So what they're telling me is that nearly 90% of you think that you're now ready to complete your logic model. About 2/3 of that number saying you can do it independently in your partnerships, and a third of that, and a third of you saying that you'd still need a bit of help. Obviously, you've got relationship managers, you've got written guidance, so you're not alone in completing this process. Obviously, one of you, I think, has said no, that you don't feel ready. I'd suggest, obviously, that that person puts a call in, puts an email in to Jim and the team, and we can talk through any concerns that you have. But it's good to see, and thanks to so many of you for responding to that question. It's encouraging to see those results. Okay, Jim, if you could just hide that poll, and we should then go through to the last screen, last one I should say, which is the timetable for the work that areas are expected to undertake. So Jim, if you could just talk us through this slide.
Okay, thank you. I'll talk through this very quickly because there's a number of questions that I'm hoping we can get through after this slide, and some of this we've already touched on during the presentation. Yeah, as you can see, this is the final of the 2 logic model webinars. As I said, they'll be available online from Monday, but the advice and guidance document and the slides are already online on my community rights. I've talked about the submission date for the logic model, and the reasons for that, and the difficulty in trying to identify dates that's fair to you, delivering the operational plan, but also enables us at this end to provide you with the necessary support and keep the funder on side. The screening of logic models, what we're looking to do is to get a panel of people together. It's a sort of expert panel, for want of a better expression, including David and other members of the ArtPlace program and delivery associates. And we will be sitting down, I think possibly on the 3rd or 4th of September, to screen the logic models that have been submitted. And then we will get back to you and categorize you either level 1 simple to level 3 complex, and then that will give you a good steer for what CBA is required. As I say, if you are classified as a level 1, there may be very little required above and beyond the logic model that you've completed. In addition to that, we have the CBA events. I think provisional dates are the 25th and 30th of September. I believe one is going to be in London, and I think provisionally one is set in Liverpool. But there'll be more information on those coming through over the next 2 or 3 weeks. As you've seen, all areas in this next phase get relationship management support of 4 days. So we did run a session for relationship managers a couple of days ago, talking them through the logic model and how they could advise and guide you over the coming weeks. Additionally, for CBA, there's consultancy support of up to 5 days. Now, ideally, we'd be looking for this consultancy support to kick in after the 1st of September, when you've submitted your logic chain, and also when you've had an opportunity to have a first meeting with your relationship manager, and you can sit down and then make review exactly what direct support you need. If you do that after you've submitted your logic chain, then that will be a more informed decision that you and the relationship manager will make. If anyone requires CBA prior to completing a logic model, and they reckon it's critical that it's done at the earliest opportunity, then if you let me know in the first instance and contact me, and we can discuss it on a sort of case-by-case basis. As I've said, there will be consultancy support that is proportionate to what you're trying to deliver and will flow from the submission of your logic chain. We then have the submission of draft operational plans for the 21st of November. There'll be a peer review process that then kicks off from the 25th of November through to mid-January, and that review process will hopefully enable you to make informed adjustments to your operational plan through discussion with areas and colleagues who are delivering something similar to yourself. And then there'll be final sign-off by locality in February, and the DCLG will sign off in March next year. So hopefully that gives you now a flavour for the support you're getting and the timeline. As we go into questions and answers, which I'll do now, I do know that there was a question from a couple of you just making reference to the tight timeline that we have, not only for the logic model or CBA, but for the program overall. Yes, I agree totally with that. It's a pressure that obviously we are under in delivering the program and our partners, but also it's a pressure obviously that you're under to deliver your operational plan. We did raise this with the DCLG during the tender stage at the end of last year, but because in effect this really could be a 2-3 year program, but unfortunately the DCLG they need to progress this at a faster rate, so they made it clear at the end of last year that this is a program that has to be completed by the March 15th. So unfortunately that is something that we just have to adhere to, but there is an acknowledgement that there is a pressure on everyone, and hopefully through the support we offer centrally in these webinars and events, hopefully we make that process easier for you, rather than creating extra hoops for you to jump through. So okay, just having a look. If we can't answer every question now, we'll try and answer them offline during next week. I think I've answered questions about timelines and expectations. There was a question from Neville. What happens if costs outweigh benefits? David?
What I'd say to that is that it's not the end of the world, Neville. The whole reason that public services exist is to deliver more than just cost savings for society. There are many things that we do, for instance, here in Greater Manchester, which we know don't deliver a positive return on investment, to use CBA terminology. But we know that we deliver them because our residents want them, or our members have been elected on a promise to deliver them, for instance. And we gather qualitative feedback, which tells people tell us that they really value these services. So if you did do detailed cost-benefit analysis for your RPlace proposal and it didn't necessarily come out saying, this is a big money saver, that doesn't mean it's a red light. I'd suggest it would just mean that you need to put more effort into getting that qualitative feedback, those things to use a cliche, the things that can't be measured, that we all know are valuable. So no, it's not the end of the world if costs end up outweighing benefits.
Okay, William was asking about fast track for operational plans. Yes, there is a fast track, William, and there's 2 organisations who are on that fast track, one of which is your own, Sutton. If the 1st of October is unrealistic, then give me a call, because as I say, the vast majority, with the exception of 2, are working to a deadline of mid-November. So let me know offline if that's an issue. Let me just scroll up other questions. Bear with me a second. This is from Richard. Will SROI be accepted as an acceptable CBA methodology?
Yeah, I'd answer that one to Richard by saying it's obviously, as Jim said, some of you in September will be informed, if you need to undertake light touch CBA or more detailed CBA or no CBA at all. For those of you in the light touch groups who are in the middle, I'd suggest approaches like SROI are perfectly fine. What those approaches do, for those of you who aren't aware, is they identify sort of high-level social outcomes, such as, for instance, improved well-being for 100 residents or whatever, and they often identify proxy values, as it's termed. So how much is that outcome worth? Well, what might people spend on counselling, for instance? That's a proxy for improved mental health. And SROI is quite simple. You just multiply the number of people by that value, and it gives you a headline figure, I suppose, for possible savings. For those of you who need to do more detailed CBA, I'd say that the model we've developed here in Greater Manchester and that Treasury and all the government departments have signed off as saying, this is our preferred approach. It has a few intermediate stages, so it needs you to look in a bit more detail about exactly how many of the residents you've supported have achieved that outcome, how many of them, things like dead weight, which some of you might have heard of, or some of those residents' mental health would have improved anyway without the programme. So it gives you a more nuanced end figure. It requires a few intermediate steps. So if you're in that group that are advised to do more detailed cost-benefit analysis, the sessions at the end of September and the advice you can get, consultancy support and so on, should help you to do the sort of the next steps beyond SROI, as it were.
Okay, thank you. A couple of questions that I can answer. Helen, is there any more training planned on using the CBA spreadsheet? Yes, it will be in those events on the 25th and 30th of September, and any slides will again be available online. Sorry, let me just look at another one. Okay, Dave, when might we hear about going further and breaking new ground? Going further, most areas have heard of the whether or not they've been successful with going further, which was the extra sort of 5,000 to 7,000. If you haven't heard, it's because either it hasn't gone to panel yet because we've only recently received your application, or potentially we've gone back to you with some further information requirements. If yours doesn't fall into any of those categories, then by all means send me an email offline, and I'll look to see where yours is in the process. Naomi was asking, are you looking for us to submit simplified bullet points like in this example, or do you want a more in-depth narrative? David?
The example I've gone through today is necessarily simplified really for time and understanding, and also space purposes. I'd say that the written guidance, which includes a blank version of the template, people could, by all means, blow the template up to A3 or even bigger, and or put it on a big flip chart piece of paper and scribble on a big table as a group what you think your outcomes are. So yours would probably be slightly more complex than the one I've run through, but it doesn't need to necessarily go into minute detail. I'd take the approach of, if somebody who knew nothing about our RPlace proposal walked in the room now, if they read this for 10, 15 minutes, by the end of that, would they have an understanding of what we're about? That's what you should be aiming for, really. So, as I say, probably a little bit more detail than I've included in the slide today, but don't kill yourselves by the 1st of September trying to get the minutiae of, putting exactly what's wrong in your local area to, really low levels and stuff like that. Just highlight some broad numbers, highlighting issues, setting out your activities and your responses, and the outcomes from those.
Okay, Hannah was asking, my question is regarding agency working together, outcomes versus mental health community outcomes. Are they separate, or is one an activity? So my question, re-agency working together outcomes versus mental health community outcomes, are they separate, or is one an activity?
If I understand Hannah's question correctly, and I'm sort of guessing what their RPlace project might be about, but what you're describing there, Hannah, is two outcomes. Often in an evaluation, you look at what are called impact outcomes, so changes in residents' or clients' lives, and you look at process outcomes, which are changes in how an organisation or a group of organisations responds to an issue, shares information, works together to prioritise issues, for instance. So in your case, you'd be describing their agencies working together, so that would be a qualitative outcome, to go back to a previous question, which you'd probably track, monitor through having regular, frank discussions of a partnership or interviews with service directors or leaders of local voluntary groups, and you'd say, are we better at working together? Yes, no, justify your response. And then you'd have an impact outcome around the mental health of the community members that you're supporting. So both outcomes, but distinguish between process outcomes for yourselves and impact outcomes for your residents or your clients.
Okay, thank you. I think we'll try and get maybe through 2 or 3 more, and then we may have to draw an end to proceedings. From Gareth, what if external factors, e.g. more ageing population, affect the impacts even though you have hit the outcomes?
But it's a very good point that in all the RPlace work, because you are all working at fairly low scale, in terms of spatial scale, neighbourhoods, communities, towns, for instance, it's unlikely that you're going to deliver massive impact upon local unemployment rates or health rates. I'm sure you'll do a lot of good within the areas that you're working, but there'll be many other factors which could contribute to what you're achieving or blow you off course, for instance, just national government policy changes, for instance. By setting out in your impact box, what impacts you're hoping to drive, it gives you that opportunity up front to identify, well, what else impacts youth unemployment rates? And throughout the course of your work, at least when you're cited on what other things might blow you off course, there's nothing really you can do about them, given at the scale that you are, but if you're aware of them, at least you can track what's happening more generally. You can identify those points. You can raise them in discussions with people. When you say, how do we feel our RPlace project went? Or you're speaking to external people, and you can say, what do you think welfare reform had an influence on what we were doing, or might have undermined some of what we were doing? And it gives you that wider contextual awareness from the start. There's nothing you can do about changing that wider context, unfortunately, unless you're a member of the government when you can set national policy. So.
Okay. Neville was asking, is the CBA then, in addition to the logic model, the logic model is, as I say, hopefully a starting point and a gauge as to how much CBA you need to do in the future. As I say, if it comes back that what you're proposing is quite straightforward, then potentially there's very little else to do above and beyond the logic chain. If it comes back as something more complex, then yes, there will be CBA that will be ongoing following delivery of the logic chain. Just have a look if there's any questions posted. I'm mindful of time now. It's getting to 4:20. I've answered that. Samantha was asking, is the consultancy support limited to CBA, or can we draw on it for other aspects of the programme? No, the consultancy support isn't limited only to CBA. And we would be delighted if you were drawing in consultancy support for other aspects of your operational plan. As I say, we're trying to be mindful that areas aren't being totally fearful of CBA and investing too much resource. So once you've had your logic chain returned and you've been classified 1, 2 or 3, once you've met with the relationship manager, hopefully then you can get a feel for the best breakdown of your how you're going to utilize your direct support. Sorry, just having a look. Philippa, I've only just been appointed, so still reading all your guidance. How many years can your project run over, e.g. 2 years, 5 years or more? I mean, obviously, the operational plan, you'll be looking at, the length of service delivery with in consultation with your partners, who hopefully include the sort of purse string holders, your public bodies, CCG, local authorities, who potentially will be holding the contracts and the monies to potentially fund your proposal going forward. So obviously the length of that will be dependent on what's happening locally and what the needs are locally, particularly what the sort of strategy and plan is for those key public bodies within your local area. I think that answers all of the questions. If I've overlooked, there's been a lot of questions coming through, so thank you very much for being engaged through the 2 hours. It's been really appreciative. If I have overlooked any questions, then by all means you can email me offline and I'll get back to you. That won't be until next week, because the locality server has been down for most of the day. But yes, we'll get back to you. Any further questions, then just give me a call or email me during next week. So just to finish, hopefully, thank you for attending on a Friday afternoon. And it's been nearly 2 hours, and we've only lost 3 or 4 of you, which is positive. From the last poll we did, as I say, the feedback was good, in that 6 in 10 of you feel confident to do the logic model independently, and another 3 of you in 10 feel that you could do it with a little help, and that help can either come from myself or, importantly, from the relationship managers. So hopefully through the session you now see where we're coming from and what we're trying to achieve in asking you to produce a logic model. You can see the reasoning behind that, and hopefully you can see the benefits to that, not only for CBA and potentially saving you time going forward using unnecessary resource, but also for the wider benefits as David has mentioned throughout the session, and myself, in relation to giving that focus and clarity on what exactly you're trying to achieve. So thank you to all of you. All I need to do now before I close the session is hand over to David to say his thank you. So thank you.
I'll keep it short and sweet. Thank you very much for tuning in, as Jim said, and I look forward to meeting some more of you at the September CBA sessions. But good luck to all of you with the logic model work over the next few weeks. Thanks, Jim.
Okay, thank you, and I'm now going to end the session. Thank you, everybody.